What's going on, guys? Welcome back to my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. If you guys are losing hair, make sure to visit my website at hairliciously.com for hair loss treatment solutions backed by science. We also released a new DHT blocking shampoo. It's actually the same as the previous one, but we added ketoconazole into the ingredient. There's a lot of good anecdotal logs to support that it is beneficial, and it also has anti-androgenic properties on the scalp. So make sure to check that out. Now, in today's video, I actually wanted to talk about a very interesting company called Veradermics, who is in the works of creating a oral minoxidil tablet that is capable of delivering a steady, continuous dose of minoxidil to your hair follicles the day and night, providing consistent stimulation without the harsh side effects or hassle of messy topical applications. Now, that is exactly what VDPHL01, Veradermics extended release oral minoxidil tablet, is designed to do. This is not going to be another version of minoxidil. It's actually a completely re-engineered treatment built specifically for android alopecia. And, unlike other drugs repurposed for hair growth, VDPHL was formulated from the start for one goal, and that was to optimize minoxidil delivery for the scalp while improving safety, convenience, and results. To appreciate why VDPHL is such a major step forward, I think it kind of helps to understand how current oral minoxidil works. The way Veradermics extended release oral minoxidil functions is fundamentally different from the conventional and the traditional oral minoxidil tablets people use today. The older tablets are immediate release, which means that once you swallow the pill, the full dose of the drug is dumped into your bloodstream all at once, which creates rapid spike in minoxidil concentrations. You can have things like, various side effects, but it also drops quickly after a few hours. The drug level is going to be high enough to trigger potential side effects such as rapid heartbeats, swelling, dizziness. And then, as your blood level crashes, the concentration often dips below the optimum range needed to help stimulate the hair follicles. So kind of like this peak and valleys pattern can make traditional oral minoxidil tablets both less efficient and also less safe. Veradermics designed VDPHL actually fixes this problem. So instead of releasing the drug all at once systemically, it actually uses a modified polymer matrix that allows minoxidil to dissolve gradually over a 24-hour period. And this controlled extended release delivery system ensures that as the tablet moves through your digestive system, it slowly releases the active ingredient into the bloodstream, and the result is a smooth, steady stream of minoxidil entering the body, a continuous trickle instead of a flood. Now, by keeping blood levels stable throughout the day, VDPHL is going to maintain consistent exposure of the hair follicles to minoxidil, which is crucial to activating these sulfotransferase enzymes that convert minoxidil into its active form. Now, the steady exposure keeps the enzyme system active longer. It's going to ensure more efficient conversion and a more reliable stimulation of the hair growth cycle. The approach also helps maintain minoxidil levels within what researchers call a therapeutic window, high enough to promote regrowth, but low enough to avoid systemic side effects. Traditional minoxidil overshoots that window at first because it's immediate, and then it drops below later in the day. VDPHL is engineered to hold that middle ground, offering the same hair growth activation with greater safety and tolerability. Now, the benefits of this design are more than theoretical. Early clinical results support the science. At the 2025 European Academy of Dermatology and Venereology, researchers presented findings from a Veradermics study comparing three groups: patients taking the extended release oral minoxidil of 8.5 milligram twice a day, and those taking standard immediate release 5 milligram oral minoxidil once a day. And then another group was taking 5% topical minoxidil twice a day. The data showed that about 82% of participants using VDPHL experienced at least moderate improvement in hair density within 4 months, compared to roughly 20% in the other two groups. Independent dermatologists who reviewed before and after photos, and these people did not know which treatment each patient received, correctly identified visible improvement in the VDPHL group 96% of the time, confirming that the regrowth results were significant and easy to distinguish. Now, some people might argue that VDPHL is actually nearly 3 times the dosage of regular 5 milligram oral minoxidil. But think of it this way. Imagine that you guys are sipping on 2 cups of coffee very slowly over 8 hours versus chugging just 1 triple espresso in 5. While the nominal daily dosage of 17 milligram from VDPHL seems higher, the effective exposure may actually be comparable or even safer than the high spike 5 milligram immediate release oral minoxidil. Now, these earlier results align perfectly with how an extended release minoxidil should perform, maintaining consistent drug levels that feed the hair follicles around the clock, leading to faster and more noticeable regrowth. Even more promising, because there are no sudden spikes in blood concentration, the heart doesn't have to respond to a rapid surge of vasodilation. That means that there's going to be less side effects, less cardiovascular strain, fewer instances of dizziness or swelling, and an overall safer and more tolerable treatment profile. A major step forward for patients who couldn't tolerate standard oral minoxidil or even topical minoxidil. Veradermics has already advanced VDPHL into large-scale clinical testing. The company's first in-human trial began in late of 2023, followed by a phase 2 in 2024 involving about 70 male and female participants. So here are some great before and after photos from their phase 2 trial results. And you guys can see that, both the vertex and the frontal regions have improved in terms of density after just 4 months, which is really incredible. And then a phase 2-3 study launched soon after, enrolling about close to 500 men across 44 U.S. sites. And a phase 3 trial for women began in 2025. These trials are designed to last about 13 months with 11 clinic visits per participant to assess hair count, thickness, and safety metrics. To support this massive clinical effort, Veradermics also raised $75 million in Series B funding in 2024, and then $150 million in Series C, which is, just tremendous confidence from investors. And, this is huge because even hair multiplication researchers like Dr. Suji weren't even close to a fraction of this amount for support. So, there is a huge hype and interest around this, and it's likely that support will continue further until potential commercialization. And although it's kind of disheartening to see how hair cloning should obviously, be the primary focus for hair restoration, you can't blame investors for pouring money into things with a more clear biologic plausibility and de-risk mechanisms. And the bottom line is that it's easier to convince investors on something with a delivery system that is already known to work versus something like hair cloning, which, the science is still early, regulatory pathways are unclear, and commercial scalability is also uncertain. Now, if these results continue to uphold, VDPHL could become the first FDA-approved extended release oral minoxidil tablet specifically formulated for hair loss, not repurposed from a blood pressure drug. And the implications are huge. A once or twice daily non-hormonal profile that works both for men and women, offering consistent follicle stimulation without any interference or cardiovascular spikes. It could also mark the beginning of a new wave of precision drug delivery treatments for hair loss, where the science focuses not on what the drug is, but how it's delivered in the body. And, it's a great concept given that the extended release delivery system provides controlled 24-hour diffusion of minoxidil into the bloodstream, maintaining optimal therapeutic levels that enhance conversion to the active sulfate form while minimizing the side effects. Preliminary data show faster and more visible regrowth compared to both topical and immediate release oral minoxidil with a significantly better safety profile. So this isn't oral minoxidil that's being repackaged. It's minoxidil redesigned for long-term targeted follicle therapy. And if ongoing trials confirm these findings, I think it can become one of the most important medical advancements in hair restoration within the next few years, potentially changing how millions treat hair loss forever. And I feel pretty optimistic about this at this point, and hopefully we can hope that this is pushed towards commercialization. We're obviously going to get more scientific data as the trials progress. But that wraps up this video, guys. Let me know what your thoughts are on VDPHL in the comments below. Thanks for watching. Thanks for all of your support, and I will talk to you guys in my next video. Take care, guys.